Natural treatment for diabetics.
Hello, welcome to our channel.
Don't forget to like and subscribe to the channel. In this video we are going to talk about how to treat the terrible diabetes. Remember that today there is already a cure for this disease, but if not treated, it can have terrible consequences for health and death with a lot of suffering. This treatment is not only to lower glucose, but also to cure type 2 diabetes, which by the way affects 95% of people who have diabetes. Procedures: focus, physical activity, food, hydration and phytotherapy. 1. If you have a profession that requires physical exertion, just take care of the food part. If your life or professional activity is sedentary, then you need to stay physically active throughout the day. 2. If you work in an office, take 2 or 3 minutes per hour to do 10 squats or whatever is comfortable for you. Also do 10 push-ups against the wall at a comfortable angle. If you have an 8-hour day, you will do 80 squats and 80 push-ups while standing against the wall, investing just 24 minutes a day. 3. Also take advantage of other opportunities to be physically active, such as going up and down stairs, walking, mowing the grass, helping with repairs or cleaning the house. That is, it is not necessary to be an athlete, but it is necessary to keep your life in a comfortable place. 4. Stretch every night at least an hour before bed. This will help combat stress, which is also a factor that can slow down diabetes. 5. Prepare your meals or instruct those who prepare them to look for foods with a low glycemic index and low glycemic load. See some tomato 3.1, avocado 6, cooked broccoli 4.4, watermelon 8.1, boiled egg 0.6, melon 7.5, cabbage 3.9. Avoid soda juices and refreshments as well as industrialized foods, the latter because it is usually full of sugar and sodium salt. 7. In the morning, drink 2 glasses of water on an empty stomach. Water dilutes glucose, helping to keep it within normal parameters. Remember to drink 2 to 3 glasses of water a day. 8. Eat until 7 p.m. if possible, always looking for light foods and mostly low glycemic index. 9. Cut wheat, especially white, for he is highly glycemic and inflammatory. 10. I sleep no later than 10 p.m. Lack of adequate sleep is a risk factor for diabetes. 11. Eat only 3 times a day, at intervals of at least 5 hours. 12. Don't eat taking liquid with the meal. Take half an hour before and an hour after. 13. Do not mix fruits and vegetables in the same dish. Eat the fruit an hour before your meal if you are going to eat vegetables. 14. As for watermelon, this fruit does not go well with anything. You can only eat it alone. Phytotherapy: for the treatment here we put only 3 types. You will choose one of them and make a liter of 15 acerola leaves or moringa leaves and drink it in 3 days like you drink water. After 2 days, measure your glucose, as it cannot drop below 70. If you already have glucose below 100, stop taking the tea to avoid hypoglycemia. The other plant is the soursop leaf. You should make tea from 3 to 5 leaves and drink it until your glucose levels return to normal. Causes of diabetes: COMBLICATIONSSMELITUS. Most complications of diabetes are the result of problems with the blood vessels. Glycemic levels that remain elevated over a long period cause small and large blood vessels to narrow. The narrowing reduces blood flow to various parts of the body and leads to problems. There are several causes for narrowing the blood vessels. The complex substances derived from glucose accumulate in the walls of small blood vessels and cause them to thicken and bleed. Inadequate blood glucose control causes increased levels of fat in the blood, leading to atherosclerosis and decreased blood flow in the larger vessels. Types of complications of diabetes: complications of blood vessels in diabetes. Atherosclerosis leads to heart attacks and strokes. Atherosclerosis is between 2 and 4 times more common and tends to occur at younger ages in people with diabetes than in people who don't have diabetes. Over time, the narrowing of blood vessels can damage the heart, brain, legs, eyes, kidneys, nerves and skin, leading to angina, heart failure, strokes, cramps in the legs when walking, claudication, vision impairment, chronic kidney disease, nerve damage, neuropathy and skin ulcerations. Infection in diabetes: people with diabetes often have bacterial and fungal infections, usually on the skin and mouth. When blood glucose levels are high, white blood cells cannot fight infections effectively. Any infection that arises tends to be more serious and take longer to heal for people with diabetes. Sometimes an infection is the first sign of diabetes. An example of this type of infection is a fungal infection called candidiasis. Candida normally resides in the mouth, digestive tract, and vagina and is generally harmless. However, in people with diabetes, Candida can infect the mucous membranes in moist areas of the skin, causing a rash there. Therefore, people with diabetes are particularly prone to ulcers and infections in the feet and legs due to poor circulation in the skin. Very often these wounds heal very slowly or never heal at all. When wounds do not heal, they often become infected, and this can lead to gangrene, tissue death and bone infection, osteomyelitis. It may be necessary to amputate the foot or part of the leg.
Eye problems in diabetes.
Damage to the blood vessels in the eye can cause vision loss, diabetic retinopathy. Laser retinopathy can seal off bleeding blood vessels in the eye and prevent permanent damage to the retina. It is sometimes possible to use other forms of surgery or injectable drugs. For this reason, diabetics should have an eye exam annually to check for early signs of damage. Diabetic retinopathy may often occur in people with diabetes who also have fatty liver disease, in which abnormal fatty deposits build up in the liver. Liver arthritis can sometimes progress to more serious liver disease, including cirrhosis. A doctor diagnoses liver problems if blood tests of liver function are abnormal, and he or she confirms the diagnosis with a liver biopsy. Losing weight, maintaining good blood glucose control, and treating high cholesterol can all help. Kidney damage and diabetes. It is possible that the kidneys malfunction, which causes chronic kidney disease that may need dialysis or a kidney transplant. Doctors often test the urine of diabetics for an unusually high concentration of the protein, albumin, which is an early sign of kidney damage. As soon as the first signs of kidney complications appear, people are often given drugs that slow the progression of kidney damage, such as TSGLT-TWO sodium glucose cotransporter 2 inhibitors, drugs that increase the secretion of glucose in the urine, inhibitors of the angiotensin-converting enzyme, which is CA, or blockers of the second angiotensin receptor, BRA. Diabetic nephropathy. Nerve damage in diabetes. Nerve injuries can manifest in many ways. If a single nerve malfunctions, the arm or leg may suddenly weaken. In case of damage to the nerves of the hands, legs and feet, diabetic polyneuropathy, the sensation may be altered, with the appearance of tingling or burning and weakness in the arms and legs. Damage to the nerves in the skin makes repeated injuries more frequent because people tend to no longer feel changes in pressure or temperature. Foot problems in diabetes. Diabetes causes many changes in the body. The following foot changes are frequent and difficult to treat. Items: the nerve injuries. Neuropathy affects the sensitivity of the feet to the point where pain is not felt. Irritation and other forms of injury may go unnoticed. An injury can pierce the skin before the person feels any pain. Items: changes in sensitivity change the way the diabetic bears weight on their feet and concentrates them in certain areas to form calluses. Calluses and dry skin increase the risk of skin sores. Diabetes can cause poor circulation in the feet. Ulcers more likely to form when the skin is injured, and ulcers to form more difficult to heal. Because diabetes can affect the body's ability to fight infection, a foot ulcer, once formed, becomes easily infected. Because of neuropathy, people may not experience discomfort from the infection until it becomes severe and difficult to treat, which leads to gangrene. Diabetics are 30 times more likely to have a foot or leg amputated than non-diabetics. Foot care is critical. See foot care. Feet must be protected from injury and the skin must be kept hydrated with a good moisturizing cream. Shoes must fit properly and not cause irritation in any area. Shoes must have adequate cushioning to distribute pressure from standing. It is not advisable to go barefoot. Regular care from a medical podiatrist specializing in foot care to file toenails and treat calluses can be helpful. In addition, the sensitivity and blood circulation of the feet should be evaluated. Please spread this video to your friends on social networks, as it can help many people to stop suffering from this disease.